stratification. So when we say risk stratification, sino ang may mga low risk, immediate risk, or high risk, no, of receiving cardiovascular and pulmonary rehabilitation. For those who are low risk, no, and they're so everyone can receive rehabilitation or those with uncomplicated myocardial injury or CABG. So your CABG, if you still remember, is your coronary artery bypass graft. So this is where diba, sa CAD, so may mga plaque formation. So what happens with coronary artery bypass graft is ginaislan ang blood vessel. Usually they take another blood vessel from other parts of your body and then nila ginabutang. Okay, so from my experience, no, sa ako nga internship, the hospital that performs CABG here in Iloilo is Medical City. So may sila nga may specialized na sila nga operating room wherein ang mga materials nila very specialized gid because hopefully by the time nga mag-interns ka mo, ma-include na siya sa inyong rotation. Kaya sa amon, dugin tour kami sa muna nga operating room wherein they perform CABGs, and it's really good because if you want to proceed to medicine, at least may idea na kamo, so pwede nyo mahambal ay gusto ko mag cardiac nga IM. Okay? So for ang iya nga certification niya sa may AACBPR, the American Association of Cardiovascular and Pulmonary Rehabilitation. Okay, so uncomplicated MI, CABG, angioplasty, or atherectomy. Okay, so either lang na sa ACP and then AACBPR. So though na sila, governing body lang sila, no. So according sa ila, those with low risk are those with uncomplicated MI or CABG. Those who have functional capacity greater than or equal to 8 METs 3 weeks after clinical event. So let's say, for example, what does that mean? So nagka-MI si patient. After 3 weeks, kaya niya mag-perform 8 METs or more na activities. So low risk siya. Next, those who have no ischemia, left ventricular dysfunction, or complex arrhythmias. Okay, and another one is no resting or exercise-induced myocardial ischemia. So this one, during EPT, no, ang EPT niya is normal. Okay, next is asymptomatic at rest with exercise capacity adequate for most vocational and recreational activities. So basically, those who are low risk are mga do nag-back to normal or very minimal ang effects sa ilasang MI. Okay? Those who have intermediate or moderate risk naman, okay, so here, functional capacity less than 8 METs 3 weeks after clinical event. So less than siya, guys, no, not equal to 8 METs. So hindi siya ka-perform mga basketball. Okay, so less than. So functional capacity naman for AACBPR is less than 5 to 6 METs. Sa low risk naman niya is greater than or equal to 6 METs. Okay? Shock or CHF during recent MI. So if nagka-shock siya, no, may moderate risk siya. And those who have depressed left ventricular function, so same man siya gyapon sa CHF. Failure to comply exercise prescription, so hindi niya kaya obrahon, no. Exercise-induced ST segment depression of less than 2 meters, so may siya nga ischemia during EPT niya. Exercise-induced ST segment depression of 1 to 2 millimeters. So this is very important, guys, no. Kay ni siya ng if may ST segment depression siya nga 1 to 2 millimeters, dapat stop muna ang EPT mo. Okay, for those with high risk naman, no, so usually gini sila dapat gid. Okay, so those with severely depressed LV function or your left ventricular function, wherein ang iya nga EF is less than 30%, is same man siya sa AAC AAC-VPR, resting complex ventricular arrhythmias with low grade 4 or 5, PVCs or ventricular contractions appearing or increasing with exercise, exertional hypotension, so every time mag-exert siya sang effort or mag-exercise siya, naganubo iya BP. May recent MI siya or myocardial injury that is age less than 6 months. Next is exercise-induced ST segment depression of greater than 2 millimeters. So, bawal, hindi siya, no? Kung greater than 2 millimeters, usually terminate exercise na gina siya or terminate your ETT if na greater than 2 millimeters ang ST segment depression and a survivor of cardiac arrest. So let's go to your exercise prescription. So what are the categories, no, or what are our basis on how to prescribe the exercises to our patient who has CAD? So of course, the duration or the frequency of your exercise should be 3 times, at least 3 times per week for 12 or more weeks duration. So dapat 12 minimum niya na minimum niya nga duration. So that's like 4 months, mga 3 months, okay? At least 3 months of cardiac rehabilitation si patient. This is very important, guys, ha? Especially kung you plan to work outside the countries, especially sa US, because very particular gina sila sa duration of the rehabilitation process kay patient because they're going to pay you kung depende sa how long are you going to perform physical therapy to the patient. Okay, so parehas man with the mandate sa American Heart Association actually is dapat every person should get 30 to 40 minutes nga ambulation or aerobic na exercises or at least 3 times a week. And the best gidya is 5 times a week. So for patients who have who had suffered CAD or post-CABG siya, it's 3 times per week. Okay? So ang duration of the aerobic exercise per session should be 20 to 40 minutes. Okay? Ang aerobic exercise training kid. And the intensity should approximate to 70 to 85% of the baseline maximal heart exercise test heart rate. So later, we're going to compute, no? So this is a constant. So karon may ara ko table wherein you can see, no, kung athlete, pila ang percentage nga dapat maximal heart rate niya. Okay? Or pila dapat ang ma-attain niya, no? Or pila lang dapat ang maximum niya. So if let's say, for example, nagsubra siya sa 85% ang iyang heart rate, so i-lessen mo na or pwede na ka mo ka-stop and then perform cool down. Okay? So your exercise prescriptions, especially for cardiac rehabilitation, should be based on FIT. So what is FIT? So FIT is abbreviated as frequency, intensity, time, and type. So that is gradually increasing with appropriate heart rate and BP monitoring. So very important, guys, nga vital signs for your cardiovascular are your heart rate and BP monitoring. Although, you should also take into consideration ng RR, no? Because, like I said, interrelated lang ang pulmonary and then cardiac systems. So the contraindications, so what are the contraindications to performing cardiac rehabilitation? So number 1 is unstable angina. So we know, no, nga unstable angina, hindi mo mapaktan kung saan siya maabot, and usually these anginas are hindi mo sila ma-trigger just by performing exercises. Next is symptomatic. If symptomatic si patient, like may na-feel gid siya nga symptoms, no, like angina and may argid siya nga substernal pain. Next is your uncompensated heart failure, uncontrolled arrhythmia, so those that cannot be, hindi siya makontrol with medication, moderate to severe aortic stenosis, so grabe na gid ang nag-ano na gino, do nag-fibrotic na gid ang iya nga aorta. Okay, next is uncontrolled diabetes. So this one nga hindi naman siya ma-control of medicines. Okay? And then if the patient has a resting BP of 200 over 110, no, dapat ER na ni si patient basi ma-stroke siya. Next is uncontrolled resting tachycardia. So dumduma ko naman, no, like I told you before, I had the patient nga daga 200 over 100 siya. Yeah. So, uncontrolled or resting tachycardia. So, ano gina sila, no? There are the contraindications. So, these are the red flags na pagkakita mo sa ila, hambal ka dayon nga. So, hindi kita ka-perform because of these. Okay? And then, take down note mo. So, PT session was not performed. Secondary to, patient having an unstable angina or patient's ECG presented with unstable angina, or the patient has a resting BP of 200 over 110. So for this one, no, usually for patients with 200 over 110 na BP, ano na ni siya, emergency. So usually ginaano mo na ni. So gina-report mo na sa ER or sa nurse. But if let's say for example no si patient may mga 140 over 90 nga BP. So this one, pwede mo siya mapahuwayan, anay. So let's say for example, nagpahuway si patient. Pagpahuway ni patient, nagnubo. So pwede ka ka-start. If hindi siya magpahuway, persistent siya sa amoni, maybe you can perform light exercises. But very, very light, hindi siya mag-induce nga mag-increase ang BP niya. Okay? But for those, of course, who has heart conditions, dapat hindi siya mag-increase gid nga amoni kadako. Okay, so let's say for example, your patient has after MI and then iya nga BPB is 110 over 70. So dapat ang increase niya depende later on the heart rate reserve. Okay, so we're going to see that later man. Okay, usually mga tag 10 degrees na ang iya nga dapat increase. So dapat kung mag-exercise ka mo, dapat naga 120 over 80 lang, no more than that. Okay? So let's go